Goni skill, thoracic and lumbar flexion. Position the patient in standing with the cervical, thoracic, and lumbar spine in 0 degrees of lateral flexion and rotation. In patient-appropriate language, ask the patient to flex the trunk gradually while keeping the arms relaxed. Palpate the pelvis for anterior tilting. Passive movement is generally not assessed due to the difficulty in moving the patient through the full passive range of motion of the spine. The end of thoracic and lumbar flexion range of motion occurs when resistance to additional flexion is felt by the patient and the examiner feels the pelvis start to tip anteriorly. The normal end feel of the joint is firm because of tension of the posterior longitudinal ligament in the thoracic region, the ligamentum flavum, the supraspinous and interspinous ligaments, the posterior fibers of the annulus pulposus, and the facet joint capsules. Passive tension of the thoracolumbar fascia and various muscles of the posterior trunk may also contribute to the end feel. See your text for a complete list of the muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. For this measurement, you will be using a flexible tape measure to record measurements. Use a skin marking pencil to mark the spinous processes of C7 and S1. Recall the technique taught in class for finding C7 and S1. Align the tape measure between the two processes and note the distance. Hold the tape measure in place as the subject performs flexion range of motion as done previously. Allow the tape measure to unwind and accommodate the motion. Observe for any extraneous movements of the pelvis. Record the distance at the end of the range of motion. The difference between the first and second measurements indicates the amount of thoracic and lumbar flexion. Make a note of the difference measured. Measure twice. If the measurements are off by greater than 2 centimeters, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient to the standing position. Average range of motion is 5 to 7 centimeters.